Good day, fellow learners. This is your mentor, your fact check buddy, Ray Gapuz, once again joining you from the Ray Gapuz review system here at our building in United Nations Avenue, Manila, Philippines. So we're on to our discussion of case number 43. But before that, may I knock on your kind soul, spirits, and the heart to please join us in this mission. Our goal is to provide free NCLEX RN application and review to 500 nurses, and to help us achieve this, just watch and finish the ads in our videos. Please don't skip. And share this video to at least 10 of your friends so that we'll pray for your success. Thank you for doing so. Before we get to start, let me congratulate Maria Winslet Mamorno, USRN from the Pangasinan State University Bayambang campus, who passed the New Mexico Board of Nursing last May 6, 2025. And let's learn from Winslet's success recipe. My test has now become a testimony. With God's grace, I passed the NCLEX RN exam at 85 questions. She's a certified 85er. It was indeed a tough battle for me. I have prepared for this a long time, along with sacrifices, and it was all worth it. The exam requires you to think critically, properly assess its situation given, and have an in-depth knowledge about the topics. But through Sir Ray Gapuz's functional concepts, bootcamp, QUICKFIX, and books such as NCLEX 311 and the Pharma book have helped me to choose the right answer. I would like to thank my family and loved ones for being with me and supporting me since day one. Sir Ray Gapuz for learning and guidance, and the whole RAGRS team for their help in navigating the TOP and guiding me with the handouts. I was so doubtful and worried, but I have learned to trust myself through prayers. My success was all because of him and only him. Praise God. Okay, so believe and say, I am next, for the Lord is with you throughout the process. Congratulations, Maria Winslet Mamorno from Pangasinan State University, and she belongs to class 2023. So that's just a couple of months ago when she graduated, and now she's a USRN. Way to go. Okay, so that's her. Okay, joining me in our bootcamp in Baguio City. Okay, so let's now begin our discussion of next generation NCLEX RN case number 43. And we're going to talk about postpartum hemorrhage, but this time around, we're going to have it in the form of a case study. But before anything else, let's recall functional concepts. Remember, functional concepts could be a concept, could just be a word, a phrase, a sentence, or even an entire paragraph that gives you a direction to how you will deconstruct questions on the test. So this is our functional concept number one. Postpartum hemorrhage is excessive bleeding after childbirth, commonly defined as blood loss of more than 500 ml after vaginal delivery or 1000 ml after cesarean delivery. Focus on how the blood loss amount is qualified. If the client delivered through normal spontaneous vaginal delivery, so blood loss of more than 500 ml, meaning more than, is considered postpartum hemorrhage. But if the client delivered through cesarean delivery, it's more than 1000 ml. Okay, it's known as the leading cause of maternal mortality and morbidity. Now, what are common risk factors for postpartum hemorrhage? Remember, you have the code PROUD. Well, you won't be proud to have postpartum hemorrhage, but at least it makes a lot of sense if you remember it using the acrostic that I created for you. So you have prolonged or rapid labor. So whether you have prolonged or precipitous labor, you can have postpartum hemorrhage. And then preeclampsia. Now, bleeding could actually occur when you experience retained placental fragments. So it's very important that after delivery, the placenta should be inspected, whether it's complete or there were fragments that were left behind. When there's an overdistension of the uterus, that's why a client who has had twin delivery or twin birth, or a client who had multiple gestation, must be assessed for postpartum bleeding. So that client is your priority for assessment of postpartum bleeding. And of course, when a client had operative delivery, like forceps delivery or cesarean section. Okay, uterine relaxants like magnesium sulfate that relaxes the uterus, or when the uterus becomes atonic, it loses its tone and relaxes. Decreased blood pressure and increased heart rate. And of course, disseminated intravascular coagulation and other coagulopathies. Now, the main problem in disseminated intravascular coagulation is that systemic clotting occurs. And because of that, the clotting factors become used up. So if the clotting factors become used up, then the client would experience bleeding. So in disseminated intravascular coagulation, the priority is to stop the systemic clotting, and heparin is usually the drug that's used to stop the systemic clotting in order to prevent the bleeding. So always remember this, in disseminated intravascular coagulation, the priority is to stop the systemic clotting first with the drug heparin. Okay, now postpartum hemorrhage is also manifested by, remember, once again, our acrostic proud, pallor, dizziness, and weakness that could be due to the blood loss, restlessness due to the decreased oxygen, including altered level of consciousness in which the oxygen levels in the brain could have decreased remarkably. Oliguria is also a manifestation of decreased circulating blood volume. And then, of course, you have uncontrolled vaginal bleeding and signs of shock like decreased blood pressure and increased heart rate. So pay particular attention to the urine output if you're assessing the response of a client with postpartum hemorrhage to whatever intervention there is that is implemented. Okay? So in postpartum hemorrhage, there are certain drugs that needs to be avoided. So which simply means that if the doctor orders any of these drugs, you have to consider the client's condition and clarify the order. So let's begin with magnesium sulfate. Magnesium sulfate relaxes the uterus, so it can worsen the bleeding in postpartum hemorrhage. Methergine is not given if the blood pressure of the client is increased, because methergine can potentially further increase the blood pressure. That's the warning that you have to remember. You do not give the methergine if the blood pressure of the client is increased. And definitely anticoagulants may worsen the bleeding, like heparin, aspirin, warfarin. Non-steroidal anti-inflammatory agents could also worsen the bleeding. And your tocolytics, the drugs that relaxes the uterus, which are usually given in preterm labor, like nifedipine. So nifedipine may relax the uterus and can potentially worsen postpartum hemorrhage. That's why if the doctor orders it, you need to clarify. And oxytocin, even if oxytocin helps promote the contraction of the uterus, before you administer oxytocin, you have to make sure that there are no retained placental fragments. In case of retained placental fragments, you do not give oxytocin. Okay, so two drugs that are not given, even if they contract the uterus, if there are manifestations that contraindicates their administration, first methergine when there's elevated BP, and second oxytocin when there is retained placenta. So in postpartum hemorrhage, anticipate uterotonics like oxytocin. Once again, let me clarify. Why is that so? That in the previous functional concept, we said that oxytocin should be avoided. That is if there's retained placental fragments. In the absence of retained placental fragments, oxytocin can be given. Okay? Your methyl ergometrine should also be given. Your mesoprostol or prostaglandin E1 and tromethamine, prostaglandin F2A, these are drugs that helps promote uterine tones. That's why they're called uterotonics. Now, pay particular attention to misoprostol, prostaglandin E1. The popular brand is Cytotec. It can potentially induce abortion. Okay? And then, of course, your tranexamic acid, which definitely would help in the control of the bleeding. Okay. So, how will we expect the progression of treatment? The first line of drug that's given in postpartum hemorrhage would definitely be your oxytocin. But you first, remember this, have to clarify that the client is not having retained placental fragments. Now, if bleeding continues despite the administration of oxytocin, methergine is given, your carboprost or misoprostol. These are actually your uterotonics. Okay, but make sure that you have to check on the contraindications. And of course, your tranexamic acid is now recommended by the World Health Organization as an adjunct treatment in all cases of postpartum hemorrhage when uterotonics alone are insufficient. So you expect that the treatment therefore could be uterotonic plus tranexamic acid, which will help prevent the progression of bleeding. Now, before we go on to the case, let me first share with you the beautiful words being shared by those who used my book, NCLEX RN 311. Some are saying it's parang actual, okay? It's parang reflection po talaga. Sir, of the QUICKFIX, YouTube, and 311, yung questions that I got. So happy I got through the exam successfully. Thank you, sir. Then Chin says, something came out. I was like, Sir Ray, know what topics would come out? I'm glad I'm a Ray Gapuz baby. And we have Vic saying, sincerely speaking, if it were not for NCLEX 311, I would not have passed. I went through it in the last 4 days of my exam. That book is amazing. Keep up the good work. And the NCLEX 311 po the best. Halos same na same po siya sa pagkakakonstruct sa mga na-encounter ko pong mga stand-alone questions. Thank you very much for the kind words. If you may want to join me in my next QUICKFIX session, you'll get this book for free, plus the pharma book and nursing reminder sheet at a cost of $3,499, including the 3 books. Okay, now functional concepts is the reason why Ray Gapuz review system produced the world's oldest NGN passer, and that's Ma'am Flor Villarreal, who passed the test last December 2, 2024 for the state of New York. Congratulations, Madam Flor Pangilinan Villarreal of Ago Foundation College, Naga City. Let's apply what we learned now to case number 43. Here we have a patient named Maria de la Cruz, who's age 29, gravida 2, para 2, and delivered via spontaneous vaginal delivery last May 13, 2025. That's just a couple of days ago. And of course, that's at 3:15 p.m. when the reporting was done. So chief complaint, patient says, Doc, I feel dizzy. I think I'm bleeding too much. My legs feel cold and I'm so weak. So there's a feeling of cold. And then some other complaints include the following. I feel lightheaded and weak. I'm soaking through the pad so fast. My heart is racing. I feel cold and my hands are shaking. The objective findings pay particular attention to the blood pressure that's so low, 85/54 millimeters mercury. The heart rate is elevated, so the client is tachycardic. The respiratory rate is also increased, and the temperature is mildly low at 36.2 degrees centigrade. Oxygen saturation seems to be close to normal, 94% on room air. And the estimated blood loss is 750 ml within 30 minutes post-delivery. And the client delivered through vaginal delivery. What did we say? Functional concepts. If you have more than 500 ml after vaginal delivery, that could be considered as postpartum hemorrhage. And then the uterus is baggy on palpation, so it has become atonic and above the umbilicus. Well, a full bladder could have pushed that up. So lochia is heavy, bright red, and continuous bleeding, and the skin is pale and clammy. So it's called in clammy and pale. There's pallor, so that could simply mean that there's decreased blood circulation in the peripheral areas of the body. So let's answer a question. An hour after normal spontaneous vaginal delivery, the nurse assesses the client. Which of the following findings is the priority indication for postpartum hemorrhage? You are being asked here about the priority indication. So that simply means that all of these manifestations could be seen, but which one would you first attend to? So perineal pain rated 6 out of 10. So that could be considered as moderate. Saturation of 1 perineal pad in 15 minutes. That's just a little fast. Blood pressure of 110 and 70. Complaints of afterbirth uterine cramping. Now, to answer this question, get a clue from what was presented in the case. And what you have here is the fact that the blood loss is 750 ml within 30 minutes. So that could have accounted for the saturation of the perineal pad in 15 minutes. And that would mean that there is severe bleeding. So the correct answer is number 2. Okay, so saturation of 1 perineal pad in 15 minutes. I just hope you were able to analyze the case that we've discussed. And so may I invite you to come over and use our simulation laboratory. This is for the next generation NCLEX, and it's always fully booked, but please do come and use it here at the second floor of the Ray Gapuz Review System building in Union Avenue. This is our classroom where we conduct our NCLEX RN QUICKFIX, our main hall for the NLE classes. And of course, we're proud to say we have the best restrooms. Look for the restroom that smells so good because it has scent diffusers, it has bidet, and of course, your toilet papers. They're in abundance. And we have students' lounge near the toilet where students could actually stay. And may I invite you also to join our more than 27,000, we're now more than 27,000 in my YouTube channel, NCLEX Ray Gapuz. I usually upload on a weekly basis. Check out my videos. And we have a promo. If you are on a tight budget, get a free review from us if you process your NCLEX application with iTaps Gapuz. For those who are intending to enroll with us for our NLE, please, we have a $999 low down payment for everyone. Join your friends and see us. For the next gen NCLEX application processing, we have a free review, okay? And for unlimited next generation NCLEX comprehensive review, we have programs that begins at 8,800 pesos with the 80 Fibers mentors and me, plus the latest NGN sample questions, and your investment would just be 2 hours daily. So the class usually begins at 7:15 to 9:30 p.m. So with that, this is your mentor, your fact check buddy Ray Gapuz, saying thank you and until our next video. Okay, God bless you, and those who are preparing for the test, just believe. And I say a functional concept a day will keep your NCLEX RN fears away. Good luck and God bless.